Bismillahirrahmanirrahim. Assalamu alaikum. Welcome. Today we are going to talk about a very important part of dental practice, managing patients with neurologic disorders and alcoholism. In this lecture, we will cover how to handle dental care for patients with seizures, disorders, and alcoholism. When managing dental patients with seizures disorder, it is important to understand how often they have seizures, what kind they are, how long they last, and their effects. Identifying what triggers the seizures help in understanding the patient's condition and preparing for any complications during treatment. Inquire about medication compliance and recent serum level measurements. Consulting with the patient's physician is essential to get a full understanding of seizures history and to decide whether to proceed with or defer oral surgery. For patients with well-controlled seizures, you can perform standard dental procedures with anxiety reduction techniques to minimize risk of seizures triggers. Patients with poorly controlled seizures should be referred to specialists who can manage them under deep sedation, ensuring safety and reducing the risk of complications. This box provides key steps for handling patients with seizure disorder. Patient with history of or a suspicion of ethanol abuse need careful evaluation before dental procedure. Key issues include liver insufficiency, interaction between ethanol and medication, any withdrawal symptoms, and potential electrolyte imbalances. Understanding these factors is essential for safe dental management. Managing patients with alcoholism requires awareness of hepatic issues that affect drug metabolism, sedation, and gag reflex suppression. Additionally, withdrawal symptoms must be monitored and managed as they can cause severe systemic complications, including seizures and circulatory issues. Patients showing severe liver disease or withdrawal symptoms should be treated in a hospital setting where comprehensive monitoring and support are available. Before surgery, perform liver function tests, coagulation profile, and seek medical consultation before surgery, and adjust drug dosages and closely observe the patient for signs of oversedation to ensure safety. To sum up, managing dental patients with seizure disorders or alcoholism involve thorough assessment, careful planning, and often multidisciplinary consultation. Effective management of these patients require detailed assessment and consultation with the patient's physician, ensuring safety and adapting treatment to their conditions are crucial for successful outcomes. Patients with well-controlled seizures can safely undergo standard dental procedures with proper anxiety management, while those with poorly controlled seizures should be referred for specialized care under sedation. Patients with a history of alcoholism require careful evaluation for liver insufficiency, potential medication interaction, and withdrawal symptoms. Severe cases should be treated in a hospital to ensure comprehensive care, while outpatient treatment involves careful dose adjustment and vigilant monitoring to prevent oversedation and other complications. Wish you best of luck.